Having previous uterine surgeries or uterine infection can also affect the health of your endometrial lining, as well as things like long-term use of fertility medication, would you believe? Medications like clomiphene. The third reason why an IVF cycle may fail is because of what is known as chronic endometritis. So by the word chronic, it essentially means that this is a condition that has been happening over time. This condition is essentially the inflammation of the endometrial lining. And remember, the endometrial lining is really important because this is what the embryo is going to implant itself into in order to eventually grow and become a fetus. The reason why many women who do have this condition don't even know that they have it is because very often it causes absolutely no symptoms. I would argue that if a woman has chronic endometritis and she has this chronic type of pelvic pain, this dull ache in her pelvis, it's actually a good thing, particularly when she is a woman who's trying to conceive. Why? Because she will, I would hope, present to her doctor, who will then do an ultrasound, and this may be identified through the ultrasound. But remember, an ultrasound might not be enough to be able to identify chronic endometritis. It may be that this woman might have to have a hysteroscopy, which is a camera that looks at the lining of the womb, and ideally a sample will be taken from the endometrium and assessed under the microscope, and that is how chronic endometritis may be identified. And so if you have gone through one IVF cycle, it's expensive, not to talk about the heartbreak. And now that you've watched this video and you are aware of it, if you've gone through an IVF cycle failure, even if you haven't and you are considering going for IVF and you come across this video, make sure that you discuss this condition with your doctor and ask him or her if there are any ways to be able to identify whether you are suffering from that, because implantation may not happen if you have chronic endometritis. What causes chronic endometritis is having infection, pelvic infections that have not been addressed for many years. So conditions like chlamydia, gonorrhea, trichomoniasis, or mycoplasma STD infections will lead to chronic endometritis. Also, let's not forget the very common bacterial vaginosis will lead to this problem. What's the good news is with chronic endometritis, it's completely treatable. Often treated once this infection is identified, a course of antibiotic, and it's important to let the lining rest and to restore itself before you go for an IVF cycle. And so what I mean by that is that once you've completed your course of antibiotic, you can't just say, okay, we're done. A week or two later, go straight for 3 months. I would argue giving it 3 months before you go again for another cycle. Number 4 are endometrial polyps and or fibroids.